Hello, my name is Diana Orozco Pulido, and I am here to give an introduction to my learning unit that I'm going to be doing this semester. A little background about me. I have been a hygienist now for almost a little over 9 years. I'm nearing my 10-year mark as far as how much work or my experience in the dental hygiene career. I graduated from Seattle Central College in 2014. And I was in general practice dentistry for about 7 years. And then in the last couple years, I have been working for a dental service organization, or a DSO, Evident Alliance, and I've been working in their perio sector. So I'm actually a periodontal dental hygienist, and I've been with them for a year and a half, almost 2 years. So within this group, they were able to do certain procedures that I found really interesting. And one of them was a laser regenerative surgery, which is called LANAP. And that is what I wanted to focus my learning unit on, because I found it really fascinating. And I thought that others would too, specifically because it was something that I didn't learn about when I was in school. And I knew that if I had learned it in school, it would have been something that I would have been really, really interested when I was learning, all the things to become a hygienist. So with that, I will go into my learning unit. If you're in dental hygiene, you know that periodontal disease is one of the most prevalent problems within the dental community, and a lot of folks suffer from periodontal disease, the severity of which varies from one patient to the next. And it's one of the things that previously the only therapies for periodontal disease was to do some sort of deep cleaning, or in more severe cases, when significant amount of bone was lost, was to do tissue flap and bone grafting procedures. However, a company was able to develop and study and get FDA approval for a tissue regenerative surgery called LANAP. They call it laser osseous. Give me 1 second. Laser osseous new attachment procedure, and basically, it's the only FDA approved procedure that will help the tissue regenerate. And by tissue, I mean bony tissue, which previously was thought to be not possible. So the patient does not get any bone grafting. There's no cutting of the tissue. There's no sutures. It's basically like a deep cleaning assisted with a high frequency laser that the doctor uses. What's really cool is that it's something that can be done in conjunction with the hygienist. I don't use the laser specifically. I still get to do just the deep cleaning part, but I do play a role in making sure that everything is set up and that the dentist has everything that they need for the laser surgery, including a lot of the post-op instructions that the patients need to receive. Again, it's a very, very cool surgery that I think a lot of people should be more aware of as an option for trying to save teeth, because that's the whole purpose of the procedure. It's a procedure that will help create new attachment that was previously, again, thought to only be possible with either bone grafting or not possible at all. Some of the things that I hope to do with my presentation, I haven't fully developed a hook quite yet. I think one of the things that I might use is a visual, either some sort of video. There's plenty of videos on YouTube that show clips of people with pretty severe periodontal disease, and the kind of signifying the prevalence and the issues with the fact that it's very hard disease and issue to control and to treat, or having some sort of like before and after, and kind of having the students give answers to as what they think was done to be able to achieve the results. And a lot of people might answer tissue grafting, bone grafting, etc. But then I could be like, nope, this was all done with a non-invasive laser surgery. So I thought that that would be kind of an interesting method to be able to introduce, like, oh wow, that's really cool, and kind of get the students' attentions. I'm going to have a couple demonstrations. One is going to be towards the end with hands-on actually getting to use the laser. Another one is specifically with the lasers that we use for this surgery, it's attracted to dark pigmented gram-negative bacteria. And one way to demonstrate that is taking a white balloon and placing a little Sharpie dot on it, and then taking the laser, placing it on the balloon on the white part, it actually won't pop, and then placing that same little dot, the laser onto the little dot, the black dot with a Sharpie, and activate it, and it actually will pop when it touches the black penciled in dot versus the white balloon, which I thought could be, again, very interesting. And then going through all of the different aspects of the surgery, the pre-op, post-op, who is a good candidate, looking at some case studies so that the students can kind of test themselves to see if it would be something that they would be able to do the surgery on. Not everyone might be able to get a chance to do this surgery, but if they have a clear understanding of what to look for when they're in a general practice setting, to be able to refer appropriately to the correct offices that might be able to do this procedure, it's a skill that I believe that most hygienists, especially newer students, should be able to have. And like I said, I would go through every single step. There's about 6-7 different steps of the procedure, show them some examples, some real life before and after examples. We have a lot of them that come from our clinic, because we do this procedure a lot. And then once again, reviewing all of the pre and post-op instructions with an actual hands-on section at the very end, where they get to set up the laser, get to look at the different settings, get to look at the different surgical procedures that are available to use. And then obviously learning all of the good safety measures that need to be taken into account, including using the glasses, how to break everything down, how to make sure everything is adequately set up and stored in a safe and effective manner. I hadn't originally planned to present this at my previous college, where I went to dental hygiene school, or one of the surrounding dental hygiene schools. Confirming the day of which I would come in with my learning unit has been a little more difficult than I expected. So my current plan is to be able to present this at our all staff meeting. There's going to be about close to 200 of us, and they're going to have a dental hygiene specific section and breakout groups, and we have a lot of new dental hygiene staff. So I'm hoping to present that to some of our hygienists that are part of our general practice offices that don't have experience with the laser but are aware of it because they refer to our periodontal clinics for this procedure. So I hope to be able to present in that day, in that time. My mentor is my direct supervisor, which is the dentist that hired me, Dr. Samira Toulouse. She's a wonderful periodontist. She is very sweet, very caring. She actually puts the patients first, which is something that I highly value as far as the ethics go with my own code, like my own moral code with regards to how I treat my patients. And she's been really great for giving me a lot of tips on how I can become a better clinician and be better for my patients and create a path that's going to help me improve with my career along the way. So yeah, I am excited to present. I'm excited to see kind of where this leads as far as other teaching opportunities, including other lunch and learns, or even potentially finally getting a good day to set up with the college to go back and teach there. They do introduce LANAP or this laser osseous procedure in their schools, but they don't have very much of a hands-on learning method there. So it would be interesting to be able to finally have some time to do that in the future, which I hope to do. So yeah, I'm excited to show you guys how it goes this semester. Thanks.